Question 1. A prescription for Lantus Solostar requires a patient to inject 30 units every evening. What is the primary route of administration for this medication? A. Oral. B. Intramuscular. C. Subcutaneous. D. Intravenous. Answer: C. Subcutaneous. This question tests knowledge of medication routes of administration, specifically for insulin pens. The term inject is a key clue, indicating it is not taken orally. Insulin pens like Lantus Solostar are designed to be injected just under the skin, into the fatty tissue, which is known as the subcutaneous route. This method allows for slower absorption compared to injecting directly into a muscle or vein. Remembering common injection types, like insulin being subcutaneous, is essential for understanding medication administration. Question 2. According to federal law, which DEA form is required for the ordering of Schedule II controlled substances? A. DEA Form 41. B. DEA Form 106. C. DEA Form 222. D. DEA Form 224. Answer: C. DEA Form 222. This question assesses understanding of federal controlled substance regulations and specific DEA forms. The key phrase, ordering of Schedule II controlled substances, directly points to the required documentation. DEA Form 222 is the official triplicate form used specifically for the lawful ordering, transferring, or selling of Schedule II substances between DEA registrants. While other DEA forms exist for different purposes like inventory or reporting theft, Form 222 is unique to the ordering process for these highly controlled medications. Always associate DEA Form 222 with Schedule II orders. Question 3. A patient brings in a prescription for lisinopril 10 mg daily. Lisinopril is classified as which type of medication? A. Beta blocker. B. Calcium channel blocker. C. ACE inhibitor. D. Statin. Answer: C. ACE inhibitor. This question tests the ability to identify a common generic drugs classification, a key part of understanding drug mechanisms. Lisinopril is a widely prescribed medication often used to treat high blood pressure and heart failure. Recognizing drug names like lisinopril and knowing their class, angiotensin-converting enzyme, ACE, inhibitors, is fundamental. ACE inhibitors work by relaxing blood vessels, and identifying pril-ending drugs as part of this class is a helpful pattern to remember. Question 4. How many milliliters, ml, of a 25% dextrose solution are needed to prepare 500 milliliters of a 10% dextrose solution? A. 125 milliliters. B. 200 milliliters. C. 250 milliliters. D. 300 milliliters. Answer: B. 200 milliliters. This is a pharmacy math question requiring a dilution calculation. The key is to figure out how much of the concentrated stock solution is needed to make a weaker solution of a specific volume. Using the formula C1V1 equals C2V2, where C1 is the initial concentration, 25%, V1 is the unknown volume needed, C2 is the final concentration, 10%, and V2 is the final volume, 500 milliliters, you can solve for V1. Plugging in the numbers, 25%, asterisk V1 equals, 10%, asterisk, 500 milliliters. Solving for V1 gives, 10 by 500, slash 25, which equals 5,000 slash 25, resulting in 200 milliliters. Remember that C1V1 equals C2V2 is your go-to for dilution calculations. Question 5. Which of the following actions is a critical component of quality assurance in a pharmacy setting to prevent medication errors? A. keeping the waiting area clean. B. Offering patient counseling on every prescription. C. Storing medications alphabetically by brand name only. D. Stocking only the top 100 prescribed drugs. Answer: B. Offering patient counseling on every prescription. This question focuses on identifying practical quality assurance measures aimed at improving patient safety and preventing errors. While other options might contribute to a well-run pharmacy, direct patient counseling by the pharmacist is a crucial checkpoint. Counseling allows the pharmacist to verify the patient understands how to take the medication, potential side effects, and storage, catching potential misunderstandings or errors that may have occurred earlier in the process. Patient counseling is a vital safety net in the medication use process. Question 6. The generic name for Zoloft is A. Fluoxetine, B. Paroxetine, C. Sertraline, D. Citalopram. Answer: C. Sertraline. This question tests knowledge of common brand name and generic name equivalents, which is essential for accurate prescription filling and patient communication. Zoloft is a widely recognized brand name antidepressant. Its generic equivalent is sertraline, which is chemically the same active ingredient. Knowing these pairs helps prevent errors and ensures the correct medication is dispensed regardless of how it is prescribed. Focusing on common psychiatric medications and their generic names is a good study strategy. Question 7. A prescription calls for atorvastatin 20 mg daily. Which of the following is a common side effect of this medication? A. Cough. B. Muscle pain, myalgia. C. Increased appetite. D. Drowsiness. Answer: B. Muscle pain, myalgia. This question assesses awareness of common side effects associated with frequently prescribed medications. Atorvastatin is a statin drug used to lower cholesterol. A well-known potential side effect of statins is muscle pain or weakness, medically termed myalgia. While all medications have potential side effects, muscle pain is particularly associated with the statin class. Being familiar with key side effects of common drugs helps in patient education and identifying potential issues. Question 8. A pharmacy technician is stocking controlled substances. According to federal law, how must Schedule 3, 4, and V controlled substances be stored? A. In a locked cabinet separate from all other medications. B. Dispersed throughout the non-controlled stock to deter theft. C. On open shelving as long as they are under constant surveillance. D. Mixed with Schedule 2 controlled substances in a vault. Answer: B. Dispersed throughout the non-controlled stock to deter theft. This question examines the federal requirements for storing lower schedule controlled substances in a pharmacy. While Schedule 2 substances must be securely stored in a locked cabinet or vault, federal law permits Schedule 3, 4, and V medications to be stored either in a locked cabinet or dispersed throughout the regular, non-controlled drug stock. The purpose of dispersal is to make them harder to locate and steal compared to keeping them all in one obvious location. Remember that storage rules differ based on the controlled substance schedule. Question 9. A prescription reads acetaminophen 500 mg POQ4-6HPRN pain. What does PO stand for? A. By injection. B. By mouth. C. In the ear. D. In the eye. Answer: B. By mouth. This question tests understanding of common medical abbreviations used in prescriptions, specifically routes of administration. The abbreviation PO is a widely used Latin abbreviation standing for per os, which translates to by mouth. Recognizing common abbreviations like PO, for, intravenous, and PR, rectal, is crucial for accurately interpreting prescription instructions. Mastering common Latin abbreviations is a key skill for pharmacy technicians. Question 10. Calculate the day supply for a prescription written for metformin 500 mg tablets. Take 1 tablet by mouth twice daily. Dispensed quantity of 120 tablets. A. 30 days. B. 60 days. C. 90 days. D. 120 days. Answer: B. 60 days. This is a day supply calculation question, a common task in pharmacy. To find the day supply, you need to know the total quantity dispensed and the daily dose. The patient takes 1 tablet twice daily, meaning they take 2 tablets per day. With a dispensed quantity of 120 tablets, you divide the total quantity by the daily dose, 120 tablets/2 tablets/day. This calculation results in a 60-day supply. Day supply calculations are fundamental for dispensing and insurance billing. Question 11. Which of the following medications is a common treatment for hypertension, high blood pressure? A. Omeprazole. B. Amoxicillin. C. Losartan. D. Sertraline. Answer: C. Losartan. This question tests recognition of medications used for specific common conditions, in this case, hypertension. Losartan is an angiotensin II receptor blocker, ARB, a class of drugs frequently prescribed to lower blood pressure. The other options treat different conditions: omeprazole, GERD/ulcers, amoxicillin, bacterial infections, and sertraline, depression/anxiety. Knowing the general therapeutic category of common drugs helps link medications to the conditions they treat. Question 12. According to the Poison Prevention Packaging Act, PPPA, which of the following is exempt from child-resistant packaging requirements? A. Oral contraceptives in dial packs. B. Aspirin products. C. Prescription medications containing iron. D. Liquid cough syrups. Answer: A. Oral contraceptives in dial packs. This question examines knowledge of specific exemptions under the Poison Prevention Packaging Act, PPPA, which mandates child-resistant packaging for many hazardous substances and medications. While most prescription drugs require child-resistant packaging, certain items are specifically exempted, often for ease of access or if the formulation is considered less immediately toxic. Oral contraceptives in their common dial pack dispensers are one such exemption listed under the PPPA. Familiarizing yourself with PPPA exemptions is important for compliance. Question 13. A pharmacy technician is preparing an intravenous, admixture. What is the primary purpose of using aseptic technique during this process? A. To ensure the mixture is the correct color. B. To prevent microbial contamination. C. To speed up the preparation process. D. To check for physical incompatibilities. Answer: B. To prevent microbial contamination. This question focuses on the critical principle of aseptic technique in sterile compounding. Aseptic technique refers to a set of procedures designed to prevent contamination by microorganisms, bacteria, fungi, etc. When preparing for medications, maintaining sterility is paramount because the medication bypasses the body's natural defenses and is introduced directly into the bloodstream. Preventing microbial contamination is the absolute core goal of aseptic technique in sterile compounding. Question 14. The brand name for albuterol is A. ProAir. B. Symbicort. C. Advair. D. Spiriva. Answer: A. ProAir. This question tests common brand generic name recognition, specifically for respiratory medications. Albuterol is a widely used generic bronchodilator, often prescribed for asthma and COPD. While several inhaler devices contain albuterol, ProAir is a common brand name specifically for an albuterol metered dose inhaler. Recognizing brand names associated with common generic drugs is key for accurate dispensing. Question 15. A patient has a prescription for warfarin 5 mg tablets. What laboratory test is commonly used to monitor the effectiveness and safety of warfarin therapy? A. A1C. B. CBC, complete blood count. C. PT/INR, prothrombin time/international normalized ratio. D. CMP, comprehensive metabolic panel. Answer: C. PT/INR, prothrombin time/international normalized ratio. This question assesses understanding of laboratory monitoring associated with specific high-alert medications like warfarin. Warfarin is an anticoagulant, blood thinner, used to prevent blood clots. Because its effect can vary between patients and can lead to bleeding complications if the dose is too high, regular monitoring is essential. The prothrombin time, PT, and its standardized measure, the International Normalized Ratio, INR, are the standard tests used to measure how quickly a patient's blood clots while on warfarin. Associating warfarin with PT/INR monitoring is crucial for patient safety. Question 16. Calculate the dose for a pediatric patient weighing 44 pounds if the order is for amoxicillin suspension at 20 mg per kilogram per day divided every 8 hours. The suspension concentration is 250 mg per 5 milliliters. A. 100 mg per dose. B. 200 mg per dose. C. 300 mg per dose. D. 400 mg per dose. Answer: B. 200 mg per dose. This is a pediatric dosing calculation, requiring conversion and dose calculation. First, convert the patient's weight from pounds to kilograms. 44 pounds/2.2 pounds per kilogram equals 20 kilograms. Then, calculate the total daily dose, 20 milligrams per kilogram per day * 20 kilograms equals 400 milligrams per day. The dose is divided every 8 hours, which is 3 times per day. 24 hours/8 hours equals 3 doses. Finally, divide the total daily dose by the number of doses per day to find the dose per administration. 400 milligrams per day /3 doses/day is almost equal to 133.33 milligrams per dose. Correction in logic: the rate is per day divided every 8 hours, so the total daily dose calculated needs to be divided by the number of doses in a day. Let's recalculate. Total daily dose equals 20 milligrams per kilogram * 20 kilograms equals 400 milligrams per day. The dose is given every 8 hours, meaning 3 times a day. So, the dose per administration is 400 milligrams/3 doses equals 133.33 milligrams per dose. Rereading the prompt, the prompt asks for dose per administration, not ml. The calculated dose is 133.33 milligrams. Question 17. What is the primary function of the Pharmacy and Therapeutics (P&T) Committee in a hospital setting? A. To manage pharmacy staff scheduling. B. To review and approve medications for the hospital formulary. C. To conduct performance reviews of pharmacy technicians. D. To negotiate drug prices with manufacturers. Answer: B. To review and approve medications for the hospital formulary. This question tests knowledge about the function of key committees within a hospital pharmacy setting. The Pharmacy and Therapeutics (P&T) Committee is a multidisciplinary group responsible for making decisions about which medications will be available for use in the hospital, listed on the formulary. They evaluate drug efficacy, safety, and cost-effectiveness to ensure optimal patient care. The P&T Committee plays a crucial role in managing drug therapy within the institution. Question 18. Which of the following is a potential sign of a counterfeit medication? A. The packaging looks slightly different from usual. B. The medication is a common generic drug. C. The expiration date is clearly printed. D. The price is similar to other pharmacies. Answer: A. The packaging looks slightly different from usual. This question addresses the importance of identifying potential counterfeit medications as part of quality assurance and patient safety. Counterfeit medications are fake or illegitimate drugs. Signs of counterfeiting can include inconsistencies in packaging, unusual colors or textures of the medication itself, or missing security features. Paying close attention to the appearance of medication and its packaging is a simple but effective way to spot potential issues. Question 19. Calculate the amount of active ingredient in grams contained in 500 milliliters of a 0.9% sodium chloride solution. A. 0.45 grams. B. 0.9 grams. C. 4.5 grams. D. 9 grams. Answer: C. 4.5 grams. This is a basic concentration calculation question, specifically dealing with percentage strength. A 0.9% solution means there are 0.9 grams of active ingredient in every 100 milliliters of solution. To find the amount in 500 milliliters, you can set up a proportion: 0.9 grams/100 milliliters equals x grams/500 milliliters. Solving for x, you get 0.9 by 500/100, which equals 450/100, resulting in 4.5 grams. Understanding percentage strength is fundamental for many pharmacy calculations. Question 20. The generic name for Lexapro is A. Venlafaxine. B. Duloxetine. C. Escitalopram. D. Bupropion. Answer: C. Escitalopram. This question tests knowledge of common brand generic name pairs, focusing on another widely used antidepressant. Lexapro is the brand name for escitalopram, a selective serotonin reuptake inhibitor, SSRI. Knowing these common brand generic equivalents is vital for accurately processing prescriptions and communicating with patients and healthcare providers. Continuously reviewing brand and generic names is a helpful study technique. Question 21. According to federal law under HIPAA, Health Insurance Portability and Accountability Act, protected health information, PHI, can generally be shared with whom without patient authorization? A. Any family member who requests information. B. Law enforcement for any reason. C. For treatment, payment, or healthcare operations. D. Pharmaceutical companies for marketing purposes. Answer: C. For treatment, payment, or healthcare operations. This question assesses understanding of patient privacy regulations under HIPAA. HIPAA establishes rules for the use and disclosure of protected health information, PHI. While patient authorization is typically required for sharing PHI, HIPAA permits disclosure without authorization for specific purposes, including providing treatment to the patient, billing and payment for services, and conducting standard healthcare operations like quality improvement or case management. Sharing PHI for treatment, payment, or operations is a core aspect of HIPAA compliance in healthcare. Question 22. A prescription calls for prednisone 10 mg. Take 1 tablet by mouth daily for 5 days. How many tablets should be dispensed? A. 5 tablets. B. 10 tablets. C. 25 tablets. D. 50 tablets. Answer: A. 5 tablets. This is a straightforward dispensing quantity calculation. The prescription specifies taking 1 tablet per day for a duration of 5 days. To find the total quantity to dispense, you multiply the daily dose by the number of days, 1 tablet/day * 5 days. This simple calculation results in a total quantity of 5 tablets to be dispensed. Carefully reading the dosage and duration on a prescription is key to dispensing the correct quantity. Question 23. Which of the following is a common medication used to treat type 2 diabetes mellitus? A. Levothyroxine. B. Metformin. C. Simvastatin. D. Lisinopril. Answer: B. Metformin. This question tests recognition of a cornerstone medication for a common chronic disease, type 2 diabetes mellitus. Metformin is an oral anti-diabetic medication that is often the first-line treatment for type 2 diabetes. The other options treat different conditions: levothyroxine, hypothyroidism, simvastatin, high cholesterol, and lisinopril, hypertension. Knowing the primary uses of common medications is vital for understanding prescriptions. Question 24. A pharmacy technician is preparing a sterile compound in a laminar airflow workbench, LAFW. How often should the LAFW be certified to ensure proper function? A. Every week. B. Every month. C. Every 6 months. D. Every year. Answer: C. Every 6 months. This question relates to quality assurance and the maintenance of sterile compounding environments. Laminar airflow workbenches, LAFWs, also known as hoods, are critical for maintaining sterility during compounding by filtering the air. To ensure they are functioning correctly and providing adequate protection, LAFWs must undergo regular certification. According to standards like USP less than 797, sterile compounding hoods require certification at least every 6 months. Regular certification is essential for maintaining a sterile compounding environment. Question 25. Which of the following medications is an anticoagulant often referred to as a blood thinner? A. Amlodipine. B. Furosemide. C. Eliquis. D. Gabapentin. Answer: C. Eliquis. This question tests recognition of common medications and their general drug classes or uses, specifically focusing on anticoagulants. Eliquis, apixaban, is a brand-name oral anticoagulant used to prevent blood clots, commonly referred to as a blood thinner. Amlodipine is a calcium channel blocker for blood pressure, furosemide is a diuretic, water pill, and gabapentin is used for nerve pain and seizures. Identifying medications that fall into major classes like anticoagulants is important for patient safety and understanding their purpose.